So my topic is meningitis, classification, epidemic meningococcal meningitis, etiology, pathogenesis, clinical picture, and treatment. Meningitis. Meningitis is an infection and inflammation of the fluid and membrane surrounding the brain and the spinal cord. These membranes are called meninges. Types of meningitis: viral meningitis, bacterial meningitis, fungal meningitis, parasitic meningitis, and non-infectious meningitis. Epidemic meningococcal meningitis. It is a rare but serious bacterial infection. It causes the membranes that cover the brain and the spinal cord to become inflamed. Meningococcal meningitis can be fatal or cause great harm without proper treatment. Etiology: the bacterium Neisseria meningitis, gram-negative, which is a gram-negative bacteria, also called meningococcus, causes meningococcal meningitis in children and teens. Meningococcus is the most common cause of bacterial meningitis. In adults, it is the second most common cause. The Neisseria meningitis bacteria are transmitted to person through droplets of respiratory or throat secretions from carriers. Smoking, close, and prolonged contact, such as kissing, sneezing, or coughing on someone, or living in close apartments with a carrier, facilitates the spread of the disease. Then the pathogenesis. First, the bacteria. It enters and colonization and penetration of nasopharyngeal mucosal membranes by the bacteria. Then there is survival of bacteria in blood and transportation via circulation. Then there is invasion of the central nervous system. Then there is multiplication in the subarachnoidal space, and there is stimulation by the bacteria and bacterial products, which increases the permeability of blood-brain barrier. Transendothelium, migration of granulocytes and monocytes. Then there is release of cytokines and prostaglandins, and their leakage of plasma protein occurs, which results in cerebral edema, increased intracranial pressure, and impaired circulation. Clinical picture: the signs and symptoms, they are like fever or chills, headache, stiff neck, nausea, vomiting, or diarrhea. Photophobia means eyes being more sensitive towards light, altered mental status, fatigue, cold hands and feet, severe aches or pain in the muscles, joint, chest, or abdomen, rapid breathing. In the later stage, a dark purple rash. Diagnosis: the diagnosis is supported or confirmed by growing the bacteria from the specimens of cerebrospinal fluid or blood, by rapid diagnostic test, or by polymerase chain reaction. Then the clinical treatment. When meningococcal disease is suspected, treatment must be started immediately and should not be delayed while waiting for investigations. Treatment in primary care usually involves prompt intramuscular administration of benzyl penicillium and then an urgent transfer to hospital for further care. Once in the hospital, the antibiotics of choice are usually for broad-spectrum third generation cephalosporins that are cefotaxime or ceftriaxone. Benzyl penicillium or chloramphenicol are also effective. Supportive measures include IV fluid, oxygen, intraopic support, that is dopamine or dobutamine, and management of raised intracranial pressure. Steroid therapy may help in some adult patients but is unlikely to affect long-term outcomes. Thank you.
Abdul Latif Mahinur, are you here?